Good evening, everyone. Desiree Kamika here. I am the Director of Community Engagement and the Housing Network. I want to first start off with saying Happy Giving Tuesday. If you haven't already, please think about what charity you are going to give back to on this wonderful Giving Tuesday. Of course, Madison House Autism Foundation would gladly accept any of your contributions to support the work that we do, just like this live stream. Some of the other sponsors that I definitely want to highlight who would not where these live streams wouldn't be possible without them, and the Autism Housing Network wouldn't be possible without them, is American Airlines, Marriott Foundation, Case Studios, and CoreLogic. Thank you so much for your support. Now, as requested, we are going to talk about public assistance programs. What is available out there to help people with disabilities, with autism and other intellectual developmental disabilities, access support? So the first main public assistance program is Social Security, and there's a difference between SSI and SSDI. SSI is Supplemental Security Income, and that's basically a cash supplement. So the maximum anyone can receive is $733 a month. Some states have an additional state supplement, but comes from federal tax dollars, and it is to help people who are very low income be able to afford housing, food, clothing. Now, of course, $733 is certainly not enough to be able to afford all of those things. So other public assistance programs are out there to help with some of those additional expenses. But Social Supplemental Security Income, SSI, has an asset limit of $2,000. So an individual who is on SSI cannot have more than $2,000 in assets. And we'll get into ABLE accounts in a little bit, but it's important to remember that. Also, if an individual with an intellectual or developmental disability or someone on SSI gets married, their maximum reimbursement decreases. So that's really important to consider. If there is a couple who are both on SSI, they will not each get their allotment. They will get a less of an allotment if they get married. So SSI. Additionally, there is SSDI, and that's Social Security Disability Insurance. And SSDI is based on the earned income of an individual's parents. So people who have worked and poured money into Social Security, when they retire, they get income from that. Additionally, if they have a child or an adult child with a disability, that individual can also draw from the Social Security Disability Insurance. It depends, the amount of reimbursement depends on the individual. One of the things that's important to know is that if an individual has an earned income of more than $1,130, their SSI payment will be influenced. So SSI, Social Security Disability Insurance, based on a parent's earned income, and then SSI, Supplemental Security Income, is a cash reimbursement that is not based on past earnings, and an individual can in some cases receive both. Additionally to a cash reimbursement, another public assistance program is Medicare, and after being part of SSI or SSDI for 2 years, individuals are automatically enrolled, and that is health insurance essentially. The other flip side that is sometimes confused with Medicare is Medicaid. Medicaid is where where all of the money for long-term support services comes from. So in order to access long-term support services. So an individual with a disability, they get SSI and or SSDI, but they need support services. They need someone to help them access their community. Maybe they need physical or occupational therapy ongoing so that their condition does not decrease, but that they're able to continually improve in their functioning. They can apply for long-term support services through Medicaid. Medicaid oftentimes will have wait lists. Almost all states have wait lists for accessing Medicaid, long-term support services. And those services and supports can be accessed in a variety of places. So an individual can live in their own home and can access Medicaid through a waiver, a home and community-based waiver, which waives the need for institutional care to access services. They could get support in an institutional setting if that would be their preference and choice. An individual can also access long-term support services in a home or a facility that's called an intermediate care facilities for individuals with developmental disabilities, and that is a situation where basically an individual's support services and their home are completely tied, and access to additional public supports wouldn't be necessary. An individual can access services in a provider-controlled group home situation, also in an adult foster care arrangement, which is also provider controlled. So an individual provider might provide the home and pay for the management of the home and pay for the food. In an adult foster care arrangement, the host home provider is responsible for purchasing the food for the individual. And so an individual will use their SSI or Ssdi to pay rent to a provider who is also giving them services, or somebody can access long-term support services in their own home, and a home that maybe they find. Maybe it's a home after their parents have passed away, they've been able to stay. It could be an apartment that they rent, and that's called a consumer-controlled setting, where an individual rents from a landlord, and then they get to choose from a variety of service providers. And if they want to change their service provider, they can change the service provider, and they don't have to move from their home. Now, unlike living in an ICF or an adult foster care arrangement or in a provider-controlled setting or in your family home, if you live in your own home, you have additional expenses that you have to worry about. The first one being, how are you going to pay for a home? How are you going to pay rent? Well, there are public assistance programs out there to be able to afford a home. There's one website that we're going to share with you in the comments section that has a lot of these different links, so we don't overload you with links, but there's a variety of different public assistance programs regarding being able to afford housing. The first big one is housing choice vouchers, and that's Section 8, so an individual has access to a voucher, and in an arrangement they can find an apartment that is within a certain income level and or a rent level, and then they will only have to pay 30% of their income. So if their only income is SSI, then they only have to pay 30% of their SSI payment for rent, and there's a subsidy that will cover the rest that comes from the government. There are also housing opportunities where a developer has used federal money or state money to develop affordable housing units, and so the units will also be very affordable. They will be fixed for people who are very low income or who have a fixed income. There are state housing and finance authorities which can help people actually buy their own home. And some of these state housing and finance authorities will also help you pay for modifications for a home. So let's say you live in your family home, but it is not accessible. Maybe there's a step going into your front door, or maybe you can't access the upstairs because climbing stairs isn't a possibility without assistance. There are ways to be able to access funding for adaptations and modifications for accessibility. And also the State Housing and Finance Authority can help you be able to own your own home. They have first-time home buyers assistance programs. Some states even have disability-specific programs where you only have to put down several $1,000s or a very small percent for a down payment on a home, and then you'll be able to use your SSI or other earned income to pay for the rest. So check out your Housing and Finance Authority. For the vouchers and for affordable housing units, you're going to want to contact your public Housing Authority, that's your PHA, and on that website that will soon be in the comments, you will be able to find the links to access your Public Housing Authority, your PHA, and your Housing and Finance Authority in your state. So once you are able to figure out, okay, I have some income coming in, I have the services and the supports that I need, I have a roof over my head, what about paying for food? There are programs to be able to help you afford food. One of them is called SNAP, and SNAP will reimburse you or give you a cash subsidy for buying food, and that can range from $19 to I had a phone call come in, but the SNAP can range from $19 to $194 in a cash subsidy or an EBT card to be able to pay for groceries. There are also programs in every local community to be able to access a food pantry or other food distribution centers. And there are typically in every state, there is a person who is responsible with the USDA to be able to help people identify how they can get their nutritional needs met. And so on the website, the SNAP website, but also there's another website for figuring out, who is responsible in your state for food distribution. I highly suggest that you can contact them and see what type of assistance you can get for paying for groceries. Additionally, once you have food, sometimes it gets cold, right? Or it gets really, really hot. And so how are you going to pay for electric and other utilities? Well, there is also a program that is called the Low Income Home Energy Program. And every state has different elements to it. So some states it's seasonal, where you can get help paying for your heating bill, or maybe it's your AC bill. But there is programs out there to be able to help pay for home expenses. Additionally, there is a program out there called Lifeline that will help people be able to access free phone and internet. Now, it's not a lot, so if you're a talker, this is probably not for you. But for some people who are low income, they just need a phone to be able to schedule doctor's appointments and check in with people, or maybe call for a ride. You can get almost, I think in 2017, it's going to be 500 minutes for free through a Lifeline program. And that also includes a little bit of data for internet as well. And then if you go over those minutes, or if you go over your data allotment, they also have reduced rates for phone and data plans. So check out Lifeline. Okay, so you have your cash subsidy, you have your housing, you have nutritional programs, you have your energy bills potentially getting helped with, your phone bill. Now you want to get a job, right? And so for individuals who are on SSI or Ssdi, I highly suggest you look at the Ticket to Work program. And this will give you information about vocational rehabilitation and the employment network to be able to access services. This is separate from Medicaid, to be able to try to find a job, or to be able to go to an institution of higher education. They will sometimes help you be able to meet your educational goals. Additionally, if you are a startup and have that entrepreneurial spirit, they can help you start your own business. So this is a program that is funded by the government to help people with disabilities be able to access a job. And that means career counseling, you'll get placed with a job coach, you'll do career exploration, you'll explore different options, but then also set goals for yourself, and all of those things are covered through VR. And if you're concerned that being able to earn income is going to influence your SSI or Ssdi payments, I highly suggest that you take a look at the Ticket to Work program. The website is right there in the comments section. So one of the other things that you can look into is a individual development account. So once you start earning a little bit of money, let's say you want to save for that down payment on a house, or you want to be able to go to a community college, or you want to buy a car, or maybe it's something to do with, you know, getting an updated electric wheelchair. There are individual development accounts that can be created. Locally, you would contact the agency and you would see what does their program entail. And it's typically a one-to-one match. So for every dollar you put into that individual development account, you will be matched $1. Isn't that great? It's an incentive to be able to help people be able to get out of poverty faster and save money without influencing their SSI or Ssdi. Another tool, another type of account that you can use to be able to save money, it won't give you money, but you can be able to save money and it won't influence your SSI, Medicaid, or Ssdi, is called an ABLE account. And those just came out. If you go to the National ABLE Resource Center, they have great webinars and information. Just because your state does not have an ABLE program yet doesn't mean you cannot open an ABLE account. There are multiple states that have ABLE accounts available for non-state residents. So I highly suggest that you look into getting an ABLE account. And an ABLE account allows people to accrue resources to pay for disability-related expenses, which includes housing, transportation, support services, education, all of those type of things. And it won't put your SSI, SSDI, or other income-based public assistance programs at risk. One thing with the ABLE account, you can only put in $14,000 a month, but then up until $100,000, the assets that are in that account won't count against you for income eligibility requirements. So please look into ABLE accounts. They are fantastic tools. So that's pretty much a rundown of the basic public assistance programs that are out there. I also suggest that you look at benefits.gov. They have this benefit finder where they'll ask you a series of questions, and you just need to fill in the answers, and it will show you what are the benefits that are potentially available to you. Additionally, you can search by states and see all of the state programs that are public assistance or benefits that your state offers and the contact information for them. So benefits.gov is a very helpful website as well. So coordinating all of these different public assistance programs can be really overwhelming, and you really want to take a lot of attention to detail. So I highly suggest that you buy a big 3-ring binder and a stack of paper, and just kind of fill the 3-ring binder with different dividers that are the different public assistance programs that you've either looked into or that you're participating in. And every time you go into that binder, or you contact somebody from one of those public assistance programs, you just make a note. Who did you talk to? What did you talk about? What are the action steps that need to be taken? Anything like that. And I suggest that you have, maybe files on the computer, but that you actually print them out and you keep that running tab of who you talked to, when you talked to them, and what were the next steps that they suggested. Additionally, you might want to consider having your loved one. So if you're supporting someone with a disability and you don't have a disability yourself, getting them in on some of these conversations, or at least trying to explain it to them, because one day you may not be around, and they should know, to the extent possible, where someone that might take care of them can find this type of information, so they also know the history of what has been done to try to access supports. Any questions? Okay, excellent. Anyone out there have any questions? Well, while we wait, again, this is Giving Tuesday. This program, these live streams, are part of our Autism Housing Network initiative. We want to be able to provide live streams on topics that are helpful. So if there is a topic that you would like to hear, please fill out our survey, which we'll also include, so that we know how effective this program is, but also so that we can know what are some of the future programs that you might want to see happening with the Autism Housing Network. Well, if I don't have any questions, good luck, and please continue to support us and giving us feedback, but also sharing these resources for others who might be helpful. Yes, so after this call, we will be updating the Autism Housing Network, and we are including a specific section in our blog for live streams, and so all of the live streams will be archived there so that people will be able to access them later. So yes, there will be a place for that. Also, again, I want to thank our sponsors, American Airlines, Marriott Foundation, Case Studios, and CoreLogic for supporting the Autism Housing Network and all the programs that are affiliated with that. How does someone get a coordinator in Maryland? Okay, so there is, you need to contact your Medicaid authority. Your Medicaid, and I'm assuming when you say coordinator, you mean like a case manager, support coordinator, and that comes through the public assistance program, which would be Medicaid. That's a long-term support service program. So what you want to do is contact your Medicaid authority. We can throw up a link shortly on where you can access your Medicaid authority, but that would be where you want to start. Also in Maryland, DOORS, D-O-R-S, you can just Google DOORS Maryland and disability, and you should be able to access that information pretty quickly. Even if you don't have Medicaid, you should at least contact them and start the process. You can be put on a waiting list. If you have a disability, if you need support, being able to start that process as soon as possible is really important. I'm not sure if you would meet eligibility requirements. If you do, that could certainly be a challenge, but they may be able to direct you to other potential resources. A lot of states have a authority for developmental disabilities, accessing supports if you have a developmental disability, which includes autism, but you can also sometimes be able to access supports if you have a mental illness or mental health challenges through that element of your state. So contacting your state and seeing if they have a separation between their DD agency and their mental health agency, you could potentially be able to access supports a different way if you have a co-occurring mental health condition. Also, and that goes for a lot of these different programs, vouchers. It is not easy to get a voucher. Many PHAs don't even have waiting lists available. Even if you're not sure if you want to live on your own or live in your own apartment, I highly suggest at least getting on a wait list if a wait list is open, because it is not easy to access those things. And the same thing with Medicaid. If you're eligible, get on a wait list, as many wait lists as you can, because maybe one day you will become eligible and you're going to want to have that choice for the future. Any other questions? Okay. Well, I hope this was helpful. Please let us know what you liked, what you didn't like. Take the survey if possible, and keep us informed of what other live streams we should do in the future. You guys have a great, great evening, and think of us for Giving Tuesday if you haven't given to a charity of choice yet. Have a good one.